Also secret, Baltimore is home to a number of health disparities, particularly healthcare access. So in a collaboration with our media partner, the Baltimore Banner, tonight we take a look to see how big of an issue pharmacy deserts really are for the city.
Yes, especially in light of a couple of permanently closing in the last few months. Dennis Valera explains what pharmacy deserts are and what can be done to help.
That was a jewel. I bought a lot of stuff out of there.
This used to be where William Smith's go-to Walgreens was. For him, it was all about convenience.
And I could even walk. Okay, I put that thing parked right there and save the gas. Okay, and do it like that.
But a couple months ago, this sign came up saying the location would close on February 21st.
I'm like, what the heck is going on? I almost cussed. Okay. You know, because I got pissed off.
As the sign reads, all prescriptions will be moved up the road to this CVS. It's a little more than a half-mile away from the old Walgreens, about a 3-minute drive. It's not too bad for Smith since he has a car, but he worries for his neighbors, especially those who, like him, walked to Walgreens because it was that close.
I'm thinking about the older people too, right? What are they gonna do now? You know, I ain't gonna say, ain't something else to do, but this is so convenient.
By definition, pharmacy deserts are areas with no pharmacies within a mile radius. WJZ's media partner, the Baltimore Banner, analyzed how prevalent this issue is in the Charm City's neighborhoods. The idea came from neighborhood reporter Clara Lago de Freitas.
Around my neighborhood, there was maybe another CVS, but nothing that would actually take my insurance. So it got me thinking, what happens in neighborhoods when there isn't a pharmacy at all, or there isn't a pharmacy that is accessible to everyone.
In an investigation shared with us, the Banner found overall in the city, the average distance to a pharmacy is just under a mile. However, some neighborhoods have it worse than others. Take a look at this map made through an analysis by data reporter Ryan Little. In yellow, those are neighborhoods where the distance to a pharmacy is above average, finding in some neighborhoods the distance to a pharmacy is nearly 2 miles. Now, most of those areas in yellow, they are black and brown neighborhoods.
Dr. Larice Edwards is a professor at Morgan State University School of Community Health and Policy.
The fundamental causes of health disparities are segregation and historical policies. And if we remove and extrapolate pharmacies from these areas, it only exacerbates the health disparities that were already there.
Dr. Edwards says on the surface, pharmacy deserts lead to a lack of medication access, but it disrupts other medical services too, most notably in the pandemic, vaccine distribution.
Pharmacies are a very important arm of the healthcare system, and for people not to be able to reach them based on geographical locations only adds to health disparities.
But there are other issues that can arise.
One thing that stood out for residents when I talked to them is that, what does that mean for the shopping center? Does it mean that other businesses are going to close?
At Erdman Shopping Center, another store is also shutting its doors. Smith is one of those neighbors wondering what's next. This treatment center, barbershop, maybe the grocery store.
If that goes, that's no good. Ain't nobody gonna come up here. Why, what they have, they ain't got no need to come up here.
Not all areas with shuttered pharmacies have this worry. In November, the Walgreens in Locust Point closed, but a new store, Five Below, already is moving in. Dr. Edwards says the two closings show the stark difference when a pharmacy closes in a lower income area versus a more affluent one.
What's it going to take to really solve this issue?
For that, Dr. Edwards has one word: policy, to bring pharmacies to low-income, disinvested communities.
And one of the ways that we could do that is incentivize these pharmacies. Perhaps through grants, perhaps through different types of reimbursements.
A link to the Banner's investigation can be found on our website, WJZ.com. I'm Dennis Valera reporting for WJZ.